Cool.
Do you know Dr. Alexis?
Yeah, she does.
These?
So good. She's so good. I follow her on Instagram. She's so good.
That's I'm like, sure, you meant to be a doctor?
Yeah, honestly. Should I carry on or should I wait?
Oh, yeah.
Yeah, okay. What was I going to say? Oh, yeah. Hi, my name's Baz and I'm a mental health pharmacist. In the last video, we spoke about the theme of this week, which is loneliness. And today I'm going to talk about how antidepressants work. So antidepressants are really commonly prescribed all over the world and in the UK. In the years 2017 to 2018, around 17% of the adult population were on antidepressants, and that's almost a fifth. And we can imagine now that's probably increased since the pandemic. So there's about 4 classes of antidepressants. So there's SSRIs, which is selective serotonin reuptake inhibitors, SNRIs, serotonin noradrenaline reuptake inhibitors, MAOIs, monoamine oxidase inhibitors, and TCAs, tricyclic antidepressants. We really love acronyms in medicine and pharmacy. But so 2 of them we don't really prescribe that often. So the TCAs and MAOIs aren't really prescribed these days. They have a lot of side effects. They interact with a lot of other medicines. But the most commonly prescribed are SSRIs and SNRIs. So I'll just briefly talk about how they work. So serotonin, we probably all know, is our happy neurotransmitter. It's important for our mood, and it's also important for regulating sleep and appetite. Noradrenaline is not talked about as much, but it's also important for our mood, and it's important for our ability to focus. And if you talk to a lot of people with depression, some of them say that they do struggle with their ability to focus for periods of time. It's also important for our fight and flight response. So low levels are sort of associated with anxiety, high blood pressure. So both of those are important for our mood and our functioning. So what usually happens is serotonin and noradrenaline are released into the space between nerve cells, and that's where they do their job. Once they've done what they need to do, they get reabsorbed back into the nerve cells. So what these antidepressants do is basically block that reabsorption, which is called reuptake. So that's why they're reuptake inhibitors. And that essentially allows the neurotransmitters to exist in that space for a bit longer and to increase the levels of serotonin and noradrenaline. Antidepressants are quite different to other medication because they take a little bit longer for them to work. So for example, if someone takes insulin, that's pretty much going to bring their blood sugar down straight away. If someone takes an antihypertensive medication, it's probably going to bring their blood pressure down within about an hour. But antidepressants usually take between 2 to 6 weeks to actually have a therapeutic effect. And that's because the nerve cells need to get adapted to the increased serotonin and noradrenaline in that nerve space. And that's something that happens on a genetic level. So that's why it takes a little bit longer. And that's how antidepressants work. So for those who might not understand exactly what serotonin is the happy hormone. So it's important for regulating our mood, our appetite, and our sleep. And it's released when we're doing things that make us happy, when we've gone to the gym, when we're eating food that we enjoy, things like that. So noradrenaline sounds like adrenaline, and it's important for when we need to sort of get into action, when we need to exercise, move around, and it's also important for our ability to focus and concentrate for periods of time. So both of these neurotransmitters are really important for our mood. And the way antidepressants work is to increase the amount of serotonin and noradrenaline in our brain. So these aren't medicines that you can just buy over the counter. You need to speak to a doctor or a prescriber to get them prescribed if you feel like you're having low mood. They're also not sort of first line. It's not the thing that we'd use straight away. Initially, you might want to try some talking therapy or something like cognitive behavioral therapy before you go onto medication. So in the next video, we're going to be talking about psychotic depression and what that is. Stay tuned.